All right, welcome everyone. Welcome to CommunityConnect Labs webinar, Stand Up for Your Mental Health Referral Program. In today's webinar, we're going to be talking about the benefits of providing referrals to your local mental health providers, some implementation challenges and how you can overcome them. We'll be talking to you about how you can effectively monitor and evaluate the referrals that you get, and we'll also be looking at the demo of CommunityConnect Labs solution developed with the state of Illinois. Right at the end, we're going to have a time for a round of Q&A, so we can answer any questions that you might have for us. Please feel free to ask us questions. They're going to help, your questions are going to help us, and they're going to help everyone else that's on the webinar. To ask your question, all you have to do is just type it out in the Zoom Q&A panel. You'll find that at the bottom of your screen. And feel free to ask questions whenever you have them. What I'll do is I'll make sure that I collect them, and at the end of the webinar, I will make sure that I ask our panelists, and we'll get you all the answers that you need. Just a reminder, we will be sharing this recording and the slides in the next couple of days, so you can revisit all the information and the answers at your own pace. So with that, I'd like to introduce the speakers for today. Our first speaker is Perla, the CEO of CommunityConnect Labs, and joining her is our VP of Product and Data, Jacob Modell. So with that, Perla, I'll hand over to you. And Perla,
great to have everyone here today. The work that you're doing at your Department of Health, your Department of Mental Health, your Department of Human Services is so vital to your communities right now. We recognize how hard it is for you to do your jobs right now, how much pressure you are to provide health services to your very large and diverse communities at this time. And we are here to hopefully help you with your mental health services at this time. We're super happy to see folks from departments from Georgia, California, Alabama, Texas, as well as from Illinois. Thank you all for joining us today. You are our people, and we're so happy that you guys are here today. If you don't know us, we are a nonprofit. Our mission is aligned with yours. We enable governments and nonprofit service providers to engage your communities. Next. Our expertise is around those populations that you know well, and providing work around census outreach solutions. We've engaged over 50,000 low-income minorities, immigrants, and other types of hard-to-reach communities. We have a background in public health. We actually started off by doing health surveys of vulnerable populations around issues around diabetes, pharmacy access, children's health. And then for mental health, we've been working on a variety of projects that deals with follow-up mental health surveys, hospital discharge surveys, as well as what we'll talk about today around the mental health referrals. In our non-health work, we've been working on job training programs, public charge assistance, which many of you guys are familiar with, as well as utility benefits for low-income populations. So we understand the challenges of engaging these vulnerable populations that you serve, and we understand, kind of the best practices for reaching and engaging those populations. Next. We're a very cross-functional team. We realize that governments need not just a technology solution, but often a full team to support the implementation of those services. So we have data expertise, engineering, as well as training, which I know is a big component of everything that you guys are doing for your staff and your potential volunteers, as well as your service providers. Next. So for training, for instance, we provide dedicated onboarding. So for your own staff as well as your providers, we provide that training for them. So for instance, in census, we've conducted over 50 webinar trainings for outreach to vulnerable populations. We've trained community health workers, including Spanish-speaking promotores. We can also help you guys with data management, as well as messaging strategy. And obviously our engineering team is here to make any rapid changes that you might need for your solutions. We understand this is a time when there's a lot of things changing. So we don't just sell you a one-time software. We're here to support anything that changes in your requirements along the way. Next. Just a couple of our health clients, we're proud to have served both a combination of nonprofits as well as county departments of human services, as well as state agencies. Next. And we've been featured in a number of publications ranging from Stanford Social Innovation Review to City Lab and the New York Times. Next. So with that, I will turn it to Jacob to talk about mental health and COVID-19 referrals.
Thank you, Perla. And full disclosure, we're not mental health experts. We're much more experts on building these systems to support the specialists in many of your county or state departments. Our job is being kind of that glue and making sure that systems work together and helping to handle the communications part of that. So when I am speaking to some of these challenges, I'll do it in kind of broad strokes rather than from a position as a mental health expert. So with that, with many of our clients, we've heard a lot of different things about the challenges in particular with mental health provision during COVID-19. One of the things that I noticed just reading the newspaper and that sort of thing is there's a ton of coverage on obviously the health challenges that hospitals are facing. I've seen much less coverage on the fact that obviously there's a increase in mental health needs, but less about the impact on the mental health system, which we've learned is really fairly dramatic as well. And there's some things about the mental health system and services out there that is pretty well designed for some virtual services. So there are services like Crisis Text Line, National Suicide Prevention Hotline that are really great for suicides and people who need these sort of crisis services. But one of the things we've been hearing is that there's fewer resources out there for non-emergency needs. So if you need emotional support or you have anxiety, kind of like some of the precursors, if you will, to people having thoughts around self-harm, that there seems to be some sort of gap there. We've heard that there's an increasing need and demand for mental health services, but it's also challenging to access those services, particularly from local providers who know the communities, who know the resources that are out there, who know local services the best. And that's in part because a lot of that has been built around in-person services. So whether that's acute care hospitals not accepting new patients or having much more limited in-person capacity, or not necessarily being designed for some of these virtual services just with their current intake processes. And so that's really where we were asked, approached at first by the state of Illinois to try to help them with a solution to bridge that sort of gap, to address some of the need that's out there, and also help local service providers adapt to the changing situation due to COVID. So next slide. So, this is sort of an abbreviated case study of what we did with the state of Illinois, and that program is branded as Call for Calm. So what we set up was a short code, so it's easy to remember. So 552020. You can text in and get a referral to a local provider. And one of the nice things about this is not only is that referral open to anyone in the state, and it is available in multiple languages, But something that's different than a lot of hotlines is it's not something where you have to hang on the phone, which might be difficult for folks or frustrating for people who need those services. It's actually a call back service where you'll receive a call from a local provider. So the process before with a lot of county mental health sites and even states is you'd have to sort of Google or search somehow for a for the phone number to then get a referral. And then often those lines are not necessarily as well staffed because of some of the office restrictions, or you'd have a long wait time, that sort of thing, and you'd get a lot of drop off. This is taking it sort of the opposite way, where there's a centralized place where everyone around the state can text into, and then we'll do the referral and generate that referral that will go out to the healthcare provider in language with information, with contact information for that person to then be called by a mental health professional. And the results have really been great. So far, we've referred thousands of clients to local providers around the state, and the level of satisfaction has been really high with the services. So one of the things that we're able to do is we're able to follow up directly with those clients to see what their satisfaction with local services, and we'll talk a little bit more about some of the advantages of doing that. Next slide. So one of the nice things is, there's been a lot of really positive press coverage, and an advantage of doing this sort of short code approach versus a website or other things is there's actually all of these news outlets like media and even providers themselves that can really easily share this. So sharing a short code and a start word, it's very simple to market. And in fact, in many of these news articles, all the way from, a student from Illinois who is studying at the University of Miami and wrote about it in their student newspaper, Miami Hurricane. But you also see a lot of local newspapers all around the state that are promoting this, as well as state reps offices and other things. It's very, very portable. So it's not something where, people don't know what the website is. If you're looking at a news article or TV and you have your cell phone out, you can just kind of do it really quickly. So that's been really interesting. And we even noticed after it was launched, there was some TV coverage and there was like a correlation between usage and, when the 10 o'clock news was on, which was kind of interesting to see, in addition to some of the print media. So it's a really portable way for you to take a service and sort of market it through a variety of digital medium or media to to really reach all sorts of different populations. So next slide. So a little more detail on what the actual process is, and then we'll go through what the user experience is. So the user texts in a so-called start word. So, you might have seen this in other text messaging applications, but there's a word that you text into a number, and that initiates the actual flow. For us, we use that word in order to assign language, but you could also use it to track marketing. So if you had a particular effort in a geography or through a channel, like you were trying Facebook ads or you were trying, TV or radio, you can track that separately as well. And what's nice from a user experience is if you, for example, in Call for Calm, if you text in hablar, you get a full Spanish experience. You don't have to do anything where you're, have to answer a question of what language you prefer or that sort of thing. So it's a pretty seamless experience. We then designed a minimal set of questions to be able to match people to local providers. That matching can be done also based on language. So, we know that there's different skills that providers have. So maybe they have, counselors who, in this case, like speak Spanish or don't speak Spanish. You can do that sort of matching. We can create those sort of databases. And we can do other segmentation as well if there's specialists in certain general issue areas, certain populations. We can do that sort of matching to make sure that it's as relevant of a referral as possible. The referral is then generated we've done integration often via email because those systems tend to be easy for providers to stand up very quickly. They can set up just an email distribution list within their current systems, or they have a point person who's monitoring that inbox to kind of triage the requests, and we'll be checking that. So that's proven to be a successful. We do have the capability, if you have a case management system that's more general, to be able to do a more technical integration with a webhook to generate a case or an event, depending how that works. So that's something that is available in the technology. But the general process is generate a referral. It goes directly to that local provider. And then really importantly, we're able, because we have that user's cell phone number, is to be able to follow up with them about their service experience. So this could be answering questions about the provider or about their experience, with a particular counselor, as well as maybe they need additional services. And that could be a referral to other social services that a local provider may not know about, or additional mental health services if that's needed. Also, if the service that was provided was not satisfactory, you can then engage in some sort of remediation. So that could be either the state or local government following up separately. That could be reassigning to another provider. That could be sending a reminder to the actual provider that they were assigned to, just in case they fell through the cracks. There's an ability to sort of do that follow-up and really close the loop. Next slide. So this is an example of what this looks like, and this is the Spanish language example from Illinois. So, the actual speed may vary depending on your cell phone reception, but this is what the user experience looks like. So you'll notice that in this case, the user types in hablar in order to start the flow. It's a full Spanish experience. We do up front have a referral to emergency services. So just in case someone is using the service and is having suicidal thoughts or self-harm thoughts, that they have those resources right up front. Then there's an opt-in, and it will continue through the referral process. So next slide. And here's just an example in English of a similar thing. So in this case, it's talk, and then going through the intake process. So you put your name, you put a zip code. In this case, it's a Illinois zip code. So there's a sample one there as well. And then it will just make the referral, and you'll receive sort of a confirmation text about that, as you see sort of at the end. So next slide. So we set up just sort of test example of this. This will not make any referrals, and is just sort of a duplicate of what we had set up, and is what is currently publicly facing for the state of Illinois. So you're welcome to take out your cell phones for a minute and give it a try. And once again, just to repeat, this is not going to actually make any referrals to providers, but you'll get a sense of what the intake experience would be like for a user. So I'll pause for a minute there. And this is a great time if you either don't have your cell phone or you have any questions so far, to put that in the chat. Great. So hopefully some of you have had a chance to do it, and certainly we'll be making these materials available afterwards. And if you want to try it on your own, once again, this number is for demo use only. It doesn't make any actual referrals. It's something that's not really meant to be advertised. It's just meant to give you a feel of what the actual experience is. So next slide. So in terms of requirements and what it takes to get something like this up and running, you know, there are very, very few questions that, or pieces of data that we need in order to set this up. And that's designed to make this just as quick of an interaction as possible. So for users, they have to text in that start word. We do really feel strongly that, in particular for this type of service, that having an additional opt-in at the beginning, particularly notifying them of what the service is and what it isn't, that it isn't an emergency service, and if they need immediate help, there are other resources out there, which could be specific to your location if you all run an emergency hotline or you know, use one provider versus another provider. So there is that sort of double opt-in, and then you have to provide some geographic information. We tend to choose zip code. You can also do things like address or other things. The advantage of zip codes is people tend to know them, and there tend to be fewer typos, and they're really quick to enter. So, you know, entering a 5-digit number at your home is really simple, and they tend to align pretty well with catchment areas for many of the providers that we work with. And then in terms of other things that you can add on, so for Call for Com, there was an option to add on like a preferred name that seemed to be important. And you could imagine that if you're receiving a phone call, if someone knows your name and they say they're from a provider, that gives the person a little more confidence that it's not a scam, that it's like a real person, that they know the source of it. There may be other you know, links to local resources that would be helpful, that can be customized, and just other things that would be helpful for segmentation. So once again, if you have providers that specialize in serving different populations or different needs, that's something where you could add a question or two in order to figure that out and help route to the correct place. So next slide. So one of the important aspects of this program, and we've seen this as well, it's really helped the Call for Com in particular adapt, is, you know, it's important to conduct monitoring and evaluation of these types of systems. So in particular, when you're trying to do any sort of technological integration, not just in this case, a sort of referral, is referrals can be dead ends, right? And so that they could be dead ends because there's some failure. So the systems themselves fail to communicate, an email goes into a spam folder, you know, that type of thing. Or there could also be failure from a service perspective, which is, you know, the person monitoring the inbox, for example, is out sick, or, you know, there's something that slips through the cracks process wise. And particularly for mental health issues, you know, it's really important to make sure that there is follow-up so that they don't really escalate into, you know, deeper problems. So one of the advantages of this type of approach is you can directly follow up with the user to both get feedback on the actual providers, but then also do this sort of remediation step. And one of the things I think has been really powerful with the Call for Com example is it's allowed us to be able to adapt the program really quickly, especially as provider capacity and needs change. So if a provider is overloaded with cases, you can actually see that in the data and get ahead of it and say, hey, maybe we should shift this around. Or if a provider is having some failure where they're not following up with clients as much as other providers, you can reach out to them and be really proactive in order to improve the quality of service. So that's something that's been really powerful about this approach, and really receiving this direct feedback from clients is it's allowed state of Illinois to spot these things and really get ahead of things, which is really great. Next slide. So we were able to stand up this program in a week, actually, even as a sort of pilot program. And then, you know, there were tweaks and other things we've made to it, but we were really sort of proud of that. That said, you know, implementation with a multiple, you know, with a large set of providers is challenging. So in the Call for Com example, we worked with providers from around the state, And I think almost each one of them had a different IT or email system. So one of the things that was really critical to getting this stood up and successful was actually going out and testing to make sure that the referrals were actually working, doing confirmation, troubleshooting there. And so that's something that we have experience with, but also making sure that you're choosing implementations that even if they're not the sexiest, they worked. So that's part of the reason we went with email, is because all the providers had email accounts. Many of them had email intakes already for this type of program. So they already had staff matched to that. But we were able to work with providers with all different levels of capacity, in particular technical capacity, to be able to make that work. There is some data that's required as well. So there needed to be a mapping of providers to locations and skills. So we needed to know which providers, were serving which areas, which providers had Spanish counselors, that type of thing. And that's something that's needed to stand up a system like this. One of the other principles that we built this with, and it ended up being really important, was flexibility. So as I alluded to before, if a provider was not pulling its weight, just being able to reshuffle that in order to get a provider that either is providing better services or has more capacity, more spare capacity for whatever reason, to be able to do that shuffling and do it quickly is really important. So for us, it was just sort of uploading a new spreadsheet of that kind of mapping, and we're able to do that really, really quickly. And actually, that's something that the state of Illinois has taken on to doing on their own. So it's not like they have to even work through us to do it, which has been a really great sort of handoff. And then also being flexible with messaging. So just as an example, and an example that I'm sure is familiar to many of you is one of the consequences of shelter in place has been a rise in domestic violence incidents. So it became clear that it was really important to try to think about, hey, this is an issue. This is something that is related to mental health, but is often dealt with by, police departments or other sorts of things. If there's really like a danger to someone, or they needed to go through the court system, whatever it might be. So providing that sort of information as part of this flow is really a crucial thing. We were able to do that very quickly. And, during COVID, there's so much changing in terms of, needs of clients as well as capacities of providers, that being able to be flexible and change messaging very quickly is really important. So with that, I'll turn it back over to Perla.
Great. And before I go on, we actually have a special guest, Sean Gallardo from the state of Illinois, who was our incredible partner in doing this work, is here with us today by phone. So I will ask him to say a couple words about if he wants to add to this project. But first, Sean, it's been such an incredible pleasure working with you.
And the feeling is absolutely mutual. Good afternoon, everyone. My name is Sean Gallardo. I am the Senior Policy Advisor for the Assistant Secretary of Programs within the Illinois Department of Human Services. We have 5 divisions, and mental health falls under our purview. But yes, so I think I just wanted to, just stop in and say a few words from our side of this program, just to give our perspective a little bit. And it has been a great partnership for us, in particular with the way things sort of were developing with COVID-19. We were able to get this up and running, as Jacob said, within a week, which is unheard of for, state government to launch something like this. But CommunityConnect Labs, they do a really good job of partnering with us to find out what it is that we actually want to do, the reason behind what we're trying to do, and then working with us to figure out the best way to utilize their technology to make it happen. So with us, we wanted people to call in to, we wanted to reach out to those who needed mental health services. And we have a variety of providers who weren't working because people couldn't come into the offices. So we said, how can we get those people to start virtually seeing people? And we worked with CommunityConnect Labs to figure out the best way to do that. And in the process, we wanted to make sure that for people who really needed help, they were getting the help that they needed. So if people were suicidal, we have a link to the suicide prevention hotline, like in the introduction. We have a domestic violence line and website, but we wanted to make sure if people were coming through, if people were using our service to try to get those services, that we were able to link them back to that as well. And they are very knowledgeable on how to do those things. And even now we're still working with them to refine on a variety of fronts, because Call for Calm is just one piece of our COVID strategy, which is constantly evolving. So I just want to, I guess, get on the record to say that it is a great partnership. They take everything that you need into account and help and work with you to make it work. And I'll leave it at that.
Thank you so much, Sean. I mean, we're just the people here who can, who are doing the engineering and programming. That part is the easier part. The work that you guys do in terms of getting through bureaucracy, coordinating all the providers, coordinating internally, that's the hard work. And you guys have done such a great job of that, Sean. Thank you so much for you and your team's leadership. And this was all your idea. So kudos to your team and for innovating at this time that we need so much innovation from government. So with that, I'll just say a couple of ending points. We are, like Sean said, we are here for you. We are a nonprofit. Our mission is your success. We want to see you guys successfully deliver mental health services to your community at this time of need. We provide an entire project team dedicated to you for planning, implementation, and testing and ongoing changes and support. We're here if you guys need training of any of your staff or your service providers. Next. I think some of you guys always have questions about pricing because we understand budget is a consideration for many of your departments right now. So we do have kind of end-to-end pricing, starting off with all the services, the training, the technical support, as well as all these features that you see here in the solution that Jacob has walked you guys through. And our prices start with the setup at $10,000 and then $4,000 a month. Those are our starting prices. And we'd be happy to talk to you about your specific needs and your budget. Next. I think that's it. Yay, QA. So we're open to any questions that you guys might have.
Thank you, Perla. Thank you, Jacob. And thank you so much, Sean, for all that wonderful information and your perspectives. Now we're just going to give everyone a couple of minutes. Feel free to use the chat, or if you would like to use the Q&A panel, please go ahead, leave us a question. Just to let you know, we do have a few questions that we've received prior to the start of the webinar. So, you have a few minutes and we can always get started with some of the questions that we've received already. So I'm just going to give everyone like maybe 30 seconds to submit their questions, and then we'll start with some of the questions that we've already received. All right. So I'm going to start with one of the questions that we received, um, prior to the start of the webinar, and that is, what happens if people contact the hotline with an emergency?
Sure, let me take that. So as Sean alluded to, one of the things that we try to do is make it clear up front what the emergency services are, and the fact that this particular referral is a non-emergency thing. That said, if someone does go through the referral process, so in addition to getting at their fingertips information that's in language for hotlines, and once again, that is customizable, but for Call for Calm, we use National Suicide Prevention Hotline, which has both a dedicated English line and a dedicated Spanish line. So that's something where it's nice to be able to direct people to the in-language resource. They have that at their fingertips. We will still generate that sort of referral, and then it's a little bit up to the provider themselves to potentially further escalate that further if needed. But we really do feel providing that information for the emergency services, which are well known, but still, for someone in crisis, they might not know off the top of their head to search for that sort of thing, or have a card from a provider for those emergency services. So we do actually feel that there is even value for people in an emergency situation to get that information at their fingertips and be able to reach out to those resources.
And Jacob, just one more question. What happens if people share information that is sensitive or information that they shouldn't be sharing?
Yeah, so part of the reason that we're doing this as a referral service rather than a two-way texting service or what have you is there is a concern about information that is personal health information or other things like that. Text messaging itself is not considered secure for that type of information. So it's really appropriate for that to be delivered through other channels that are potentially more secure, like certain types of emails or phone calls or that sort of thing. We do get the data, on our side, and that's something where we can delete that information immediately if that's something that we're sort of noticing. But part of the reason that we set it up this way is so that users don't provide that sort of information, that they really do get this call back. And if a provider has a secure chat service or other type of secure web form to provide more information, that is something that we could offer, but we don't directly provide that sort of two-way messaging.
And so a few minutes ago, we talked about evaluating referrals and closing the loop. So what do you do if a referral does actually get dropped?
Yeah, so once again, if a referral gets dropped, I think it is really important to follow up with that client, and that's something that we do in this sort of automated way, and give them a chance to provide feedback, and also let the sort of central entity, so the state or local government or large nonprofit provider, know that this was dropped. I think we then defer, and this is part of the setup and customization, like what the right remediation step is, and that might depend on your situation. So if you have staff that can directly follow up with that client and talk to them and try to understand the situation, that's something that can happen. Once again, if it's sort of giving them information about a different provider, if they were unsatisfied with an experience, you can do that type of thing. So that's something that we would work with you on. But the really important part is getting the feedback and actually knowing that it was dropped. That's really important, I think. And sometimes it's because a provider was unable to reach the person, that it went straight, a call went straight to voicemail, or a ton of things that we're used to like that. And so sometimes it's totally benign, and other times it's sort of indicative of these larger systemic issues. So you know, it is a little bit of a case-by-case basis, but we can help you figure out what the logic is that's.
All right. And so we did get this one a couple of times, which is basically how long does it take to set up? So once someone, you know, gets in touch with us, how long will it take for, you know, for us to get a program up and running?
Yeah, so once we have, you know, typically it would take a day or two to get the requirements and make sure that we're aligned there. Once we actually have the data on which providers would be available and that sort of geographic mapping, you know, it's pretty quick. As I mentioned, we got the state of Illinois up in a week. Part of that was they were great partners and had the data kind of available quite quickly. We were able to test it. The thing that actually took the longest in terms of implementing it was the testing with the providers. So in the case of the state of Illinois, we actually went provider by provider to get confirmation that they were able to receive a referral. And that's, you know, very important. And even as the program evolved, some providers ended up shifting from a single person to like a distribution list for emails, and we had to retest those as well. So, you know, there is a little bit of this testing that comes in and coordination with the providers, and that we were able to do in about 3 days. We were able to cover pretty much providers in the state. So that was a lot of effort, certainly on the state of Illinois side, and it would be similar for that sort of setup. But for, you know, for someone else, but it is something that can be done quite rapidly.
Thank you. And so Perla, if you could, you know, if you could weigh in on the next question. So there's a lot of, you know, there's a lot of questions currently around technology and privacy. How do we ensure privacy? Also, how is our solution user-friendly and you know, not going to scare away users rather than, you know, rather than help them?
Yeah. So we're very sensitive to those questions because we know that, you know, everyone's affected by COVID-19, but it also disproportionately affects our most vulnerable populations. And so first of all, you notice this is an opt-in. So people text in if they want to get help. And secondly, the questions that we ask are very, very light we're just asking for your, you know, the language and your zip code if you want to call back. So it really collects very few personal details about people. And then lastly, it's available in multiple languages. In Illinois, it's available in Spanish. And we have been getting folks texting in who are Spanish speaking. And it's wonderful to be able to see that those communities are able to use this resource. I think, you know, when you're thinking about technology that needs to be able to accessed by many different populations, you have to think about those things around language access, about, you know, whether or not this is something that, you know, requires internet access. In our case, texting is used by, you know, 95% of our populations. Text messages are read 90% of the time. You don't need internet. It's very cheap. In fact, it's part of most cell phone plans, so there's no additional costs to it. So those types of, you know, thinking about it from the perspective of those users in terms of the language access and the cost and their accessibility is what's going to help governments gain the trust of their communities that they're serving, that they are thinking about them and putting themselves in their shoes to be able to more easily access these services.
Yeah, and just quickly on that, you know, we have, when we're not doing things around mental health, we do other work around census and other benefit access as well. And we fielded products in about 24 languages. So that's something that is really important to us, you know, ensuring that we have high quality human translation and that sort of thing to make sure that things are accessible and inclusive.
One of the final questions we have is, you know, do you as a consumer or end user need a data plan to use this service?
So as Perla mentioned, you don't. I think what we've found in our platform is multi-channel. So we do have the ability to have sort of like web chat widgets to work over Facebook Messenger or Line or Telegram or other popular messaging services, and we do have products on that. That it really depends on the community that you're trying to reach, what the right channel is. I would say text messaging is the lingua franca, and you don't need a smartphone to actually use it. So that's one of the advantages to it. But as you can see from research from Pew and others, there are different preferences by different groups for how they want to message. We choose SMS as a primary channel because it is the most inclusive. But having those options out there may fit other audiences better.
So that brings us to the end of the Q&A session. Thank you so much, Perla. Thank you, Jacob, and thank you, Sean. I just want to remind everyone that we will be sharing the slides and the recording to this webinar. And in the meantime, we've also listed out a couple of, we've listed out a website for you to, if you would like to read up more about the solution that we shared today, or if you would like to send us an email and chat further, if you would like us to tell you more about our mental health solution, we would be more than happy to do so. So thank you so much, everyone, for joining in today, and we hope to see you again soon.
Thanks, everyone. Feel free to email us if you have any questions. info@communityconnectlabs.com.